Prime Minister's playing word games again. He pretends that there's a difference between legalization and decriminalization. Basically the same thing, but we'll use his word. He brought in decriminalization in British Columbia, which led to a 380% increase in overdose deaths, 2,500 deaths last year, the worst death count in any province's history. So will he, A, admit that his decriminalization in BC was a deadly disaster, or B, admit that he plans to do it again right across the country, everywhere after the next election?
The Right Honourable Prime Minister.
Mr. Speaker, earlier the Leader of the Opposition was suggesting I did my homework. You'd think that on an issue that the Leader of the Opposition is making so much fundraising money off of, he would have actually done his work and realized there is a difference between legalization and decriminalization, and that's one that really matters. We, yes, responded to a request for a pilot project by British Columbia to continue to try and approach new approaches in solving this toxic drug overdose epidemic, and we will continue to work with British Columbia as we have, as they choose to make adjustments to their pilot project, because we know saving lives and keeping communities safe is the most important thing.
The Honourable Leader of the Opposition.
Mr. Speaker, I just asked now 4 times whether he plans to replicate in Montreal, in Toronto, or anywhere else the radical experiment that he's had to backpedal on in British Columbia. He won't answer the question. He has a request from the Montreal Mayor, the Toronto City Hall, and we don't know what other municipalities. So either A, he believes the experiment was a disaster, or B, he plans to repeat it. Which is it?
The Right Honourable Prime Minister.
Mr. Speaker, I have answered this question many times by saying that the only way we move forward on any proposals across this country around decriminalization or other methods to support to fight the toxic drug overdose is when provinces step up and actually ask for it. Failing that, we will not be moving forward on any modifications. However, there are provinces that are choosing to reduce their harm reduction measures, and we will continue to increase harm reduction and public health responses to overdoses and safe supply issues right across the country.
So you will go against the province, but you won't go against the province, but you will.
Mr. Speaker, now let's talk about extremism. Last week, there is a party leader in this House who was expelled for the use of the word extremist, and he did not apologize. Today, the Prime Minister is commending his friend for having used exactly the same word to witnesses, guests at a committee. Is this a double standard, or is he going to also expel his crony from the Francophonie Parliamentary Assembly? That's the Right Honourable Prime Minister.
One time I like the question from
Mr.
the bloc.
Speaker, as I said earlier, I expected the member to apologize and withdraw his remarks, and that's exactly what he did. At the same time, Mr. Speaker, we're going to continue to defend the French fact across Canada and in the world with our participation in the Francophonie, with our conviction that not only do we have to protect both our official languages across the country, but we also need to be there to invest in and protect French in Quebec. And we're the first government to have done so, and we're going to continue to be there to protect French throughout the country. The Honourable Member for Belleuil-Chambly. I just heard him say that both official languages have to be protected. Where does English need to be protected? Next summer in Montreal, there's going to be the equivalent of a Francophonie Parliamentary Assembly in Montreal that's going to be chaired by his buddy. But I think I've understood, Mr. Speaker, for the Liberals, they're trying to tell everyone that French is fine in Quebec and they don't have to do anything. That's just to appease English Canadians, isn't it? The Right Honourable Prime Minister. On the contrary, Mr. Speaker, We are the first government, the first federal government, to recognize that we have a specific responsibility to protect and help in the protection of French in Quebec. No other government before ours has done this, and that's because we recognize that we have to do more to protect French. But unlike the Bloc, we are not only focusing on French in Quebec. We're going to continue to protect it across the country. In Acadia, we're going to do it in Ontario, in Manitoba, in the north, across the country.
The Honourable Leader of the Opposition.
Not only is the Prime Minister refusing to rule out future decriminalization across the country that has just failed in BC, he's now just announced he plans to spend even more tax dollars on narcotic opioids. According to the Vancouver Chief of Police, 50% of the recovered hydromorphone was originated with government programs handing it out as so-called safe supply. This program has led to a 166% increase in drug deaths across the country since it was brought in. Why won't he accept my common sense plan to stop giving out deadly drugs and start giving out treatment?
The Right Honourable Prime Minister.
Mr. Speaker, the Leader of the Opposition proposes to return to the failed Harper-era approaches on opioids that their own former advisor, Benjamin Perrin, called obsolete and immoral. Mr. Speaker, over the past number of years, we've invested in a compassionate, science-based, evidence-grounded approach that includes harm reduction, that includes approaching with a public health lens on this. It also includes investing in housing, in mental health supports, in frontline workers, in addiction treatment and recovery programs. These are the things that move us forward, Mr. Speaker.
The Honourable Leader of the Opposition.
Mr. Speaker, when we were in government, there were 60% fewer overdose deaths. This problem accelerated after he brought in these radical programs that are not done anywhere else to give corrupt pharmaceutical companies money to hand out more drugs. David McAvoy, an addiction outreach worker right here in Ottawa, says that he witnesses the so-called safe supply clients diverting their taxpayer-funded drugs to the black market and that they are given, quote, an insane quantity of drugs. Will the Prime Minister stop giving out insane quantities of heroin-grade opioids and start bringing treatment so we can bring our loved ones home drug-free?
The Right Honourable Prime Minister.
That we even have to talk about
I don't know that
this.
any Canadian would think that adding more ideology to our approach to public health, dealing with the opioids epidemic, is a solution, and yet that's the only thing that the Conservative Party seems to offer. We will continue to be grounded in a compassionate, science-based approach that works with local partners, that attempts to provide the kinds of wraparound services, whether it's housing, whether it's healthcare, whether it's addiction treatment and recovery, whether it's culturally appropriate services for those who need it. We will continue to be there to help heal people, not imprison them.
The Honourable Leader of the Opposition.
They are there to help kill people right now. That's exactly what they're doing. And, Mr. Speaker,
Don't. I swear to God, if Greg makes him withdraw this,
I'm going to... Colleagues, I'll be coming... Colleagues... We are going to, the Speaker will come back to this issue. I'll allow the Honourable Member to continue his questions. 24 seconds on the clock.
not only is his policy killing people, but this Prime Minister is by far the most radical ideologue who's ever occupied that job. Yes. But always with these radical policies comes profiteering. The companies that are making the money off of the opioids that are funded by Canadian taxpayers, and it is indeed sick, Mr. Speaker. Will the Prime Minister agree to release all of the contracts for those pharmaceutical companies?
Great question, but he could barely get it out because they're heckling, and Greg's not even stopping them.
Prime Minister.
Mr. Speaker, we are facing right across the country a toxic drug and opioid epidemic that is taking lives left, right, and center, that is hurting communities, that is hurting family members who are losing loved ones at an alarming rate that is something we need to respond to. And we have continued to work jurisdiction by jurisdiction in thoughtful ways to try and do everything possible to both keep communities safe and to keep families from suffering these further losses and support people struggling with addiction. We will continue to be grounded in evidence and support.
Right on. The honourable member from Vaughan Wood.